My second lecture about minimum standard for pharmacies in the hospital. So I am Muhammad Arshad Yaqub and go through my lecture. Thank you. First of all, I tell you about the what purpose, main thing, purpose of this guideline. Why we are making this guideline? What is the benefit of these type of guidelines? So pharmacists work closely with other healthcare practitioner to meet the need of the public. So this is a combination of the pharmacist work. How do they work with other healthcare practitioners like doctors, nurses and other staff, and the various societal needs for pharmaceutical care required that the pharmacies provide a wide array of the organized services. And the primary purpose of this documents is to serve as a guide for the provision for the pharmaceutical services in hospital. So this is a guideline, and then this should be guide us how to serve to the patient as well as the administration, and certain elements may be applicable to other healthcare setting. These guidelines, which I mentioned, and I will tell you the next slide. These guidelines should also be useful in evaluating the scope of quality of these services. As providers of pharmaceutical care, pharmacists are concerned with the outcome of their services and not just to provision of these services. ASHP, abbreviation of American Society of Health System Pharmacy. So ASHP minimum standard guidelines. The following minimum standard guidelines are intended to serve as a basic guide for the provision of pharmacy service in hospitals. So these guidelines should be help us to how to standard or minimum standard of our pharmacy should be maintained or should be start from these standards. And this standard is very hospital to hospitals. It is not necessary to all hospitals obeying this all the points of this guidelines, but this vary. This guideline outlines a minimum level of services the most hospital pharmacy department should consistently provide. The reader is strongly encouraged to review the American Society of Health System Pharmacy guidance documents. Certain elements of these guidelines may be applicable to other healthcare settings or may be useful in evaluating the scope and quality of the pharmacy service that I told you before. If the standard of the hospital should be increase the standard of the um, pharmacies, so should be obey these standards. ASHP minimum standard guideline, American Society Healthcare minimum standard guidelines. This also you can see the elements. The elements or minimum standard guidelines of pharmacy program that are the critical to overall successful performance in a hospital include, just I mentioned the 6 standards. And say extended, there are different lines in which the pharmacists can be doing this advancement and their works. So standard number 1 should be the leadership and practice management. Pharmacy should be the do the abilities of its leadership and practice management. There are so many, actually there are so many positions of the pharmacist. On the top position, they you can say the director of the pharmacy, and also there are different levels. I just explain later one by one. And standard 2 drug information and education. This is also the part of the pharmacist in hospital pharmacy to provide the drug information and provide the education to the pharmacists as well as healthcare professionals. Number 3 standard number 3, activities to ensure rational medication therapy. So there are some rational medications, some are irrational medication also. If you know about the rational medication, so irrational medication also be, you can learn about that. So activities to ensure rational medication therapy. Standard number 4, drug distribution and drug control. Drug distribution for inpatient as well as for outpatient or other side also. Not only distribution but also control. Standard number 5, facilities, equipment and information resources. Standard number 6, participation in drug therapy research. Research also the last topic in my inshallah the fourth lecture. I will give only for research topic, how the pharmacist should be research and how is this benefit for the research in current scenario also. So just a few things I just tell you about. I will say standard number 1, leadership and practice management. So effective leadership is a standard number 1. Effective leadership and practice management skills are necessary for the delivery of the pharmaceutical services in a manner consistent with the hospital and patient's needs as well as continuous improvement in the patient's care outcome. Pharmaceutical services management must focus on the pharmacist's responsibilities to provide pharmaceutical care and the development of the organization structures to support that mission. So there also I told you about the responsibility of the doctor and of the pharmacy. There are so many. I explained you this in my next lecture also. Just I told you about the pharmacy mission. The pharmacy shall have a written mission statement that at a minimum reflect both patient care and operational responsibilities. Other aspects of the mission may be appropriate as well. For example, educational and research responsibilities in the case of teaching and research hospital. So we can support, the pharmacist should be support personnel's work schedule and assignments, help in education and training, orientation of personnel, performance evaluation, position descriptions, operational manual to making the help to making the manual, operation manuals, drug expenditures, workload and financial performance, quality environments, quality assessment and improvement, 24 hours pharmaceutical services, and this is 24 hours and after hours pharmacy access also, law and regulations. So these are all the things I told, that is very important, and these are also duties of the leadership, and there's a practice management. If you see the standard number 2, drug information and education, this is also very useful and was for the drug information. The hospital pharmacist or the clinical pharmacist which is in the hospital duty, the pharmacist shall provide patient specific drug information and accurate and comprehensive information about the drug to other pharmacists, other healthcare professionals and other patients as appropriate, up-to-date drug information shall be available, including the current periodical and recent editions of the textbook in appropriate pharmaceuticals and biochemical subjects areas. Electronic information in a computer also. There are so many websites, so many informative things inside the electronic informations is desirable. This information may be provided in the conjunctions with medical libraries and other available sources. Appropriate drug information resources shall be readily accessible to the pharmacies located in patient care areas. No medication should be administered to a patient unless medical and nursing personnel have received adequate information about and all familiar with its therapeutic means potential adverse effect and dosage. So for drug information, just we can say there are so many things the pharmacy should have. There's a drug information requests, medication therapy, monographs, patient education, this is all the work. This drug information product, drug information. Standard number 3, you see in the slide. Standard number 3 is activities to ensure the rational medication therapy. So we can say optimizing medication therapy. Optimizing medication therapy is an important aspect of the pharmaceutical care in optimizing medication use. This must include processes designed to ensure the safe and effective use of medication and increase the probability of desired patient outcome. That is also called the rational medication therapy. The pharmacist, in concern with the medical and the nursing staff, must develop the policies and the procedure for ensuring the quality of medication therapy. And also the pharmacist should work in the medical record documentations, medication histories, medication orders, medication therapy monitoring, therapeutic purpose, medication use evaluation, medication use policy development, documentation of pharmaceutical care and outcome, continuity of care, work, design or redesign, clinical care plan, microbial resistance. If there is some microorganism are resistant, should be work with the micro lab and just check the antibiotics and other things. Medication therapy decisions, immunization. If there is a vaccines, so take care about the vaccines and other things. Substances abuse programs. Now, slide number 4. In a slide you can see drug distribution and control. Drug distribution, I told you before, there's different areas, the distribution to inpatient, outpatient, and first of all just purchase and distribute to the store also and others, and also control of these things. The pharmacy shall be responsible for the procurement, distribution and control of all drugs products used in the hospital, including the medication related devices also. Suppose BP apparatus, sugar monitoring apparatus, glucometer and other things, and pharmaceutical diagnostic for inpatient and also for ambulatory patients. Policies and procedure governing these functions shall be developed by the pharmacy with input from other appropriate hospitals, staff, and community. Also, there are some medications order can check, formulary, drug formulary, prescribes or prescriptions, medication administrations, extemporaneous compounding, and also sterile products, preparation of a sterile product, and compounding for non-sterile preparations, unit dose packaging, medication storage, adverse drug reaction, medication error, product drug product recalls, patients on medications. Some patients are using the medication and come for refill medications. Vendor representatives dealing for the vendors and as a purchaser, deal different companies and vendors and purchase from the medication from them, from the companies. And then sampling, manufacturer and supplier contact with them, controlled substances, some controlled medications which are issuing for only for the specific patients, and some protocol also involved in this medication dispensing. Non-drug substances, medication storage area inspections, floor stock checking, disaster services, medical emergencies, and drug delivery systems. These I told you before, there are where we can deliver the drugs, inpatient, outpatient, and other sites. Now you check standard number 5, facilities, equipment, and information resources. To ensure the optimal operational performance and quality patient care, adequate space, equipment, and supplies shall be available for all the professionals and administrative function related to the medication use. These resources must be located in the area that facilitates to the provision of the services to patients, nurses, prescriber, and other health care providers, and must be integrated with the hospital communication and delivery or transportation systems. Facilities shall be constructed, arranged, and equipped to promote the safe and efficient work and to avoid the damage and deteriorations of drug products. Medication storage facilities shall exist to enable the storage and preparation of medication under proper condition of sanitation, temperature, light, moisture, ventilators, ventilations, segregations, and security to ensure medication integrity and personal safety throughout the hospital. Some other work like they can do in this standard 5, which is packaging and compounding, cytotoxic and hazard drug product, drug information, consultation spaces, automation, record maintenance, computerized system. Now see the last one, standard 6. In standard 6, participation in drug therapy research. In research, I told you that I can give you the one separate lecture about the research. The pharmacist should initiate, participate in, and support medical and pharmaceutical research appropriate to the goal, objective, and resources of the specific hospital. There are some policies and procedures they can make, distribution and control, institutional review board, drug information also include this in this page. So there is also more explanation of this standard. So I told you before that in my next lecture I just explained you through about this standard and the work of the pharmacies. So these six standard I told you thoroughly, and in my next lecture also explain these collectively. These elements or these standards represent a minimum level of practice that all hospital pharmacy departments must strive to provide on the consistent basis. While the scope of the pharmaceutical service will likely vary from site to site. I told you that all hospitals are not the same size, same or not all of same departments. Like some have cancer area, anti-cancer treatment. Some have good for the gynae side. So all hospitals not have all the departments, so they have vary from site to site depending upon the need of the patients served. And if we failure to provide any of these services may compromise to overall quality of the pharmaceutical care. So should we maintain these six standards so we can increase our standard of pharmacies in the hospitals. This guideline outlines the minimum requirement for the pharmaceutical service in hospital. So I told you before that reader should be encouraged to review this ASHP practice standards. Refer throughout these documents for a more detailed description of the component of these services. Now here in this slide I just discuss about the objects. What are the object of hospital standardization? There are several objects. I just mentioned only three here. Just you go through your reference books and other side and just add more in your notes. But I just mentioned here the object of hospital standardization in all its phases is to promote to care and welfare. So main keyword is to care, promote the care and welfare of the sick. This is main point. We can work for the patient and for the patient care, and also give to the patients the full benefit of modern medical and hospital services. Recognizing that better organization, planning and facilities will be necessary to permit them to keep pace with the many discoveries and advances that are now prominently associated with the application of the drug therapy. And third one, each hospital must necessarily vary its method, space, and facilities to meet the need of its own patient through this effort. For more description of minimum standard guidelines, see my next lecture. I prepare for another one, and this is also for good for examination point of view. Those students want to give the exam appear in the examination of hospital pharmacy, just see my next lecture about descriptions of this six minimum standards guideline. I just thoroughly just explain in my slide, but I just provide you the notes also in my next lecture. And for that purpose, just you subscribe my YouTube channel also, and click the bell and click the like also. Thanks for stay with us. Thank you.